I just had the fastest interview I've done all year, and it was with Dr. Peter McCullough. You guys know who he is? He's the fellow who was on Joe Rogan, been all over the place because he was one of the early doctors cited in over 1,000 publications. Credible man who said, hey, not so fast with the vaccine over there. Bam, did he get hit. But he was proven right. And he was only proven right, but he's talking about, as I go into this broadcast today, what about the aftermath? We have a lot of mortalities that are unexplained, and a lot of young mortalities, and a lot of maternal deaths. And it's like you can't sweep this stuff away. 19%, 20%, you're probably the 19% that didn't take that vax, like me. So I've got him on the show today, and I really wanted to get him in here because we have him speaking at a special summit. You've got to get smart. Frankly, you got to be your own doctor. It's like the flu season, vaccines. What's good, what's not? How do you really manage your own health and such? I'm doing a special summit. It's for smart people. It's going to be smart health and wellness. I've got guys like Dr. Peter McCullough and other top doctors, cardiologists, etc. And listen here, how do you do it? Mark down January 15th through 17th at the Trump Doral, Miami. It's going to be beautiful there, hot, warm, delightful. We got smart time. We're going to learn about how to be your own best doctor. You got brain fog, you got spike protein we're going to talk about today. People that still have mRNA vaccine stuff in their system. You have no idea what's still floating around. We're going to learn all about it. That's January 15th through 18th, healthsummit.us. And you can learn about how to get your front row seat. Now, we're going to have a mastermind on the 18th, and I'm going to have my buddy Ed Rush join me for that. And we're going to talk about how to be delivered so that spirit, soul, and body starts the year off right. We'll see you there, and let's get into today's program. Now, look, I've got a very special guest, so all of you behave yourself. We got Dr. Peter McCullough, who's published 1,000 publications, 700 citations, and has testified before the U.S. Senate. Of course, I saw him on the War Room and Joe Rogan, and he became an overnight sensation because he wasn't saying what everybody else was saying. And so even though it may have cost him, his street creds went up big time with the millions of us that knew something was up with that with the vax. And then he started talking about shedding and the spike protein, and that, oh my gosh, it opened up a whole new world. Let's welcome Dr. Peter McCullough.
Lance, great to be on the program. Thank you.
All right. People have hundreds of questions. I was just asking you about a new study that skewers the jabs. This is from Coffee and COVID, that author. The deaths prove links. mRNA lingers in awkward places. And in Germany, they did something rather courageous. They came up with a discussion of the pandemic, and they have a sudden surge of excessive mortality that keeps on climbing post-COVID, but they're not relating it back to the vaccine, but they don't have an explanation as to the mortality that came after the jabs. And so the suspicion is, based on the data, what's causing this excessive mortality? Do you have any thoughts on this?
Well, ever since 2021, mortality has been going up. It's been going up in all different age groups, but prominently young people. 2021, by the way, was a terrible year for maternal deaths, women delivering babies, middle-aged individuals, and most everybody's been through COVID, and COVID became progressively milder. It mutated to milder strains. We developed more and more sophisticated treatments for COVID. So COVID should not be an explanation, in fact, is not an explanation for the increased mortality seen worldwide. It really coincides with rollout of the COVID-19 vaccines, which have peer-reviewed, published, fatal side effects. Can be the only answer.
Can be the only answer. So, and you were the first one that freaked me out. With my son, for instance, wasn't vaxxed and went to the doctor and came up with some evidence of spike protein in his system, and that was when I started listening more closely on shedding. Is that a real thing? I mean, for those of us that didn't take that jab, but then we're realizing, hey, it doesn't mean you're out of the zone there.
Mm-hmm. Well, Lance, about 19% of us did not take the vaccine. I didn't take the vaccine. I'm a doctor. It's my judgment they weren't safe. And boy, was I right. Do you know CDC former director Robert Redfield was out this week on an Epoch Times? He also said the vaccines weren't safe and they should be removed from the market. He was one of the biggest promoters of the vaccines 5 years ago. So
My gosh.
people are starting to come around with the conclusion that they're not safe. Now, the vaccine superloads the body with spike protein. And there's a paper by Barham and colleagues showing the average antibody level against the spike protein in someone who took the shots is about 11,000. I see patients 15, 20,000 binding units per ml on this blood test. It's available through LabCorp, by the way. Anybody can have it. Your son probably had it. Now, if you've had the infection alone, it should be less than 1,000. Now, people who start to be over 1,000 and have had the infection, we wonder about shedding, that is either recurrent SARS-CoV-2 infection exposure or exposure from spike protein from those who've taken the vaccine. They're loaded with it. We know it comes out in exosomes, exhaled breath, sweat, body fluids. Whatever the source of the spike protein, some of us have more of it than others. It is related to side effects if the spike protein value in the bloodstream is greater than 1,000.
Does it just go away by itself, or do you have to do something to really deal with that?
You have. That's the problem. I just saw a patient today who's got a terrible neurologic problem and a heart problem due to the vaccines, Moderna vaccines, and the spike protein is loaded in her body. What patients have to do is they have to take this product here, the Ultimate Spike Detox from the Wellness Company. This is a medicinal high-grade combination of nattokinase, bromelain, and curcumin. This is the highest dose product on the market, and it's the only scientifically supported, peer-reviewed, evidence-based approach to have the body clear this spike protein. Modern medical centers don't even measure the spike protein in the bloodstream, nor do they address it with products like this. Now, this is copyrighted in my name because I was the first to publish the protocol, but it's not patented intentionally because the individual ingredients anybody can find on the internet and come up with their own protocol just to match the McCullough protocol is fine. But you have to do this, Lance, and your son should do it. Almost everybody we know who's had the infection or taken the vaccine should do it. It's dangerous to leave the spike protein in the body because it can end up leading to blood clots or heart problems later on.
Well, you were the first one that had postulated that the iodine solution appropriately dissolved and sprayed in the nasal passage. I mean, when I brought this up, even AI is goofy. I bring it up and it goes, oh, no, that's not a solution. I go, you're not even educated. Come on, Elon, get Grok up to date here. But yeah. I was trying to figure out how could you be around all these patients and you yourself were doing so well. And then you said you would do this nasal spray with iodine, right?
Right. I did it this morning. So any type of nasal spray with, saline nasal spray, dilute iodine, xylitol, colloidal silver, they all work. I like the ones that are a combination. So like today, I had a xylitol-based one. I put a few drops of iodine and some salt in it. But a couple sprays up the nose, sniff it back, spit it out, and then gargle. Scope, Listerine, spray. Gargle, and do this twice a day because the virus lands in your nose. It's in there for a week, getting stronger and stronger, and you don't feel it. It actually needs a stable environment. Then you get a sore throat, then the nasal congestion. So you've actually had a week to knock it out if you just do it twice a day, Lance.
You're going to be one of our key speakers at our health summit. I want everybody to make sure you know it's going to be in January. And I know you're thinking Christmas and shopping and this. Nothing's more important than this kind of intelligence that you get because you're in the season anyway with all the flu craziness we're going to be talking about. You can reserve your seat. It's healthsummit.us. Come on down to sunny Trump Doral in Florida, and when it's freezing cold everywhere else, come join me. We're going to have an all-star cast of the smart health people. These are people that are the ones that get banned everywhere else but are actually speaking the truth. And by the way, it's flu season now, so I got a question for you. I feel like I'm with my doctor here taking advantage of you for a broadcast. With flu shots widely published, what alternatives do you recommend? Or with this flu season ramping up, what are the treatments everyday Americans should be using?
Every day the flu shots get weaker and weaker, Lance. They don't provide really any meaningful protection. So the Wellness Company has a really premium product, nasal spray and throat spray called Immune Defense. So make sure you get Immune Defense. Use that twice a day. You could additionally gargle, later on at night or in the morning. But immune defense, get that at Wellness Company, and then get a Wellness Company Black Contagion Kit that contains oseltamivir and all the drugs needed to treat flu. Remember, influenza is very mild if you treat it on day 1. You wait to day 5 and get really sick. Different story.
Whoa, whoa, whoa. This is why people need to come to this summit. And by the way, you need to be paying attention to this before the summit. Now, the kit includes ivermectin, right? Boy, did that get a brand revisit after it was proven to be so. After it was horse, poor Joe Rogan got smacked around for horse medicine or something like that. But ivermectin is proven to be a big deal still, right?
Yeah, ivermectin turned out to be one of the most useful drugs. In a study done in Florida, the ICON study published in Chest, it reduced mortality from COVID for inpatients by 50%. It should have been used in every hospitalized patient. Sadly, hospitals denied patients, pharmacies shut down distribution of it. It's a very useful drug. It's used to treat a whole array of viral infections now. It's used to treat parasitic infections. Cedars-Sinai, UCLA actually has a cancer treatment protocol featuring ivermectin. So and with any human crisis as big as the pandemic, there should be positive spinoffs, and ivermectin is one of them.
Okay, so here's a big question for you. You were named the top healthcare freedom advocate for 2025. What is Robert Kennedy Jr. doing right now that we should be getting behind? What changes are happening? I don't think the Maha movement it doesn't have its own channel like War Room with Bannon where everybody gets informed. What's happening there that we should know about?
Well, I think Robert F. Kennedy and others in HHS have figured out that there is a biomedical deep state, just like there's a geopolitical deep state within government. There's a deep state of entrenched employees by the thousands who don't want change. And what Kennedy has done through his skillful redesign of the immunization committee is that they're shaking up vaccines. They will be, I think, almost certainly lessening the burden of vaccines on children, starting with the hepatitis B shot and the rest of the schedule. We're looking into radical transparency on government decision-making as it happened with COVID. Now the FDA, somebody ethical inside the FDA, Lance, leaked out a report where they knew 10 children who died after the vaccine. They had 96 total. The CDC reporting system has 200. Now they're starting to admit the vaccine actually cost people their lives. And Americans are welcoming this transparency, and they want to know what's next because the next steps obviously involve justice.
They sure do. And, I only got 40 seconds left in this segment. Do you mind if I hold you over? Because I just want to do part 2 of this interview. We got 15 minutes, 12 minutes left. And I've got a couple of questions from the audience here I want to give him. We'll be right back. I got something coming in January at the Trump Doral with all of my favorite doctors. I got a whole group of medical experts going to talk about making you Maha healthy. You're going to make you healthy and going to make you wealthy and make you wise for the race of your life, because we're not going to lose. Last year at this time we were celebrating. This year at this time we got a wake-up call, but we're going to win this battle and not lose. Go to lancewallnau.com/wellness and you'll see why Wallnau is doing a wellness conference January 15th through 18th at the Trump Doral. Listen, it's cold up north. Come down to Florida. All right, lancewallnau.com/wellness. Save your seat. All right, we're back with Dr. Peter McCullough right now, and I'm interested in this deep state pharmaceutical medical situation. My concern is that Donald Trump, and I don't think people fully appreciate this, what he's got is he's got the top layer with a Pam Bondi and he's got Kash Patel, Dan Bongino. People don't realize that we're even hard on them because they don't move fast enough, but they're on top of a leviathan of deep state infrastructure that is probably just waiting for this summer storm of Donald Trump to pass so they can get back to business as usual. Does it concern you at all that there's that much entrenched bureaucracy, particularly in the medical field, that is interfering with real solutions?
Lance, it's astounding to think that the Centers for Disease Control, the CDC, has 12,000 employees. MDs, PhDs. These are highly educated people. They have a $9 billion budget. They don't treat a single patient. They don't operate any clinics. They don't develop any new medicines. I mean, this is a giant sinkhole of American dollars. I think for what the CDC does, which is some, tracking and surveillance of infections and the recommendations they put out, I would say no more than 1,000 are needed.
Wow.
But not 12,000, not $9 billion of money. And since the pandemic, Lance, they've been working from home. They're on Zoom. These people don't want to give up their jobs. They don't want to make a single change. I bet the leaders in HHS, Kennedy and others, I bet it's hard for them to get a meeting because these people don't show up. And I would imagine they actually don't follow orders.
My gosh. Therefore, is there anything that all the viewers that are watching this are nodding their heads and going, yeah, and it's frustrating. Is there anything that people can do to support the efforts that are being made by Kennedy, by folks like you? I mean, what's the way that we deal with this?
The way we deal with it, I think, is supporting outside, very influential forces. So, we lead one here in Dallas, the McCullough Foundation. We issued a report on autism, October 27th, 2025, that clearly showed giving kids big bundles of vaccines is probably a risk factor for autism based on the evidence. Do you know within 3 weeks, the CDC changed their statements on the website? And then, a few weeks after that, Trump is saying the whole vaccine schedule should be overhauled. It's actually external forces like the McCullough Foundation, like Flashpoint is very important. Your efforts in the media, we're actually having a bigger influence than insiders are in Washington.
Wow. Well, that's kind of encouraging. Is the supply chain still an issue in your opinion? Because we stopped talking about it, but nobody who understands the global complexity of China, we're really dependent on China a lot, aren't we?
We're far too dependent on China, and Trump made some constructive steps on bringing pharmaceutical manufacturing back to the United States, and I hope there's a complete pull-through on this from HHS and the Department of Commerce. If things got sideways with China, they could constrict us on things like critical blood pressure, diabetes, cholesterol, heart medications, cancer medications. So virtually all the generic drugs come from China or India. And so I think everybody should be, again, talking about this to make sure that we do begin to bring pharmaceutical manufacturing and supply chain back to the United States.
Well, my big concern is when I think apocalyptically, I think about how our country regulates to some degree, obviously, what we do, or we wouldn't have been over in the Wuhan lab trying to get around the American system, which nobody talks about. But I'm concerned about ghastly experiments that are being done with the human body and where there's no regulation on this. I mean, I heard this weird comment that Putin and Xi made, and I believe it was made intentionally so that it could be overheard, where she was talking about how it's possible to live to 100 or 110, 120 because you can harvest organs. And they're talking about literally replacing parts of your body that don't work. And I'm thinking, what in the world are they doing in China where they have no regulatory restraints on what they do? If there was something that concerned you about unmanaged experimentation in this area of science, it very well could be that there could be terrible new things released that are the unintentional consequence of meddling like that. And look how fast it could start in one country and spread to another. Do you ever think about that in your Stephen King nightmare mode? Or
well, we've addressed this on Focal Points, our Substack and at the McCullough Foundation. Trump stopped federal funding for biolabs for these pathogens of dual purpose potential. That is, creating a pandemic and then creating vaccines to address the pandemic. But he didn't shut down the labs. Now, these labs could be richly funded by the Gates Foundation, these other non-governmental agencies that are in the business of creating pandemic viruses. I think we should shut down the labs altogether, Lance. They can't be regulated in the United States. Do you know we have 14 of them in the United States? One of them is in Galveston, Texas. That's pretty close to where we are in Dallas. And I got to tell you, there are leaks. These labs are not inspected, or they're certainly not free of risk, and they're just, in a sense, inviting trouble. Remember Peter Daszak, who helped Ralph Baric and Fauci create the SARS-CoV-2 virus in Wuhan? He testified and said, I've got dozens of more samples over in Wuhan. So he's got like COVID-20 locked and loaded, and the Chinese have it.
My God. That's just so shocking. So, and of course, if they could come up with a vaccine, and they have it, you know how this bioterror works, folks. This is a weapon. It's like nuclear weapons. So if you can experiment in your lab and come up with the vaccine, then you've got it, and other countries don't have it, and they got to figure out how to get it, and you launch a bioweapon. Isn't that the scenario of how that thing works?
Precisely. It's a power grab. If you hold a threat and you hold the answer, it's like holding a nuclear missile and holding a nuclear defense system at the same time. It's just now transferred into this new era of biowarfare. That's the reason why Ukraine is of interest to many degrees. All the biolabs there. There's biolabs all over the world. And I hope somebody at the new administration is looking at this carefully and mapping it out, because there will be a next pandemic, but it's going to come out of a lab, not out of nature.
Which makes it even more sinister, because it's engineered so that there's no real biological way of resolving it. So, Mike, one of my fears is that we are so anti, vax now, because we don't trust the government, we don't trust the CDC, that what happens if something breaks out that you actually need to be vaccinated for? Most people that are coming from this education process are saying, the heck with that, I won't do it. And it's created a tremendous distrust, hasn't it?
It's so true. People don't trust the government at all. Now, the wellness company is a trusted source of information, and we have a whole array of home medical kits for the common things. But, we also have a radiation kit. We have the very large home base kit. And people out there, especially in your audience, Lance, who are preppers, they're people who want to prepare for disasters. They do work with companies like the wellness company, get things pre-prescribed, and so they're prepared.
Well, okay, here's a plug for you folks out there, lancewallnau.com/medical. I'm working with Dr. Peter's resources now. Use the code LANCE, save 10%. And, we've got people that are all prepping with food and stuff in the event that there's a disruption of the food chain. But, man, you want to be able to definitely be preparing yourself for the medical arena as well. What is on the horizon for you, Peter? I mean, when you look at the next thing you're putting your energy into, what are you focused on at this point?
We're looking at ways of clearing out the spike protein. We have Ultimate Spike Detox. We believe a second product of a supercharged N-acetylcysteine will help. And then we want to find ways of getting the messenger RNA out of the body. Right now, we rely on hyperbaric oxygen and saunas and sweating. It does come out in sweat. There may be ways of actually, in a sense, what's called ribotecking or simply neutralizing the messenger RNA out of the body. And, many are looking towards the microbiome, how to favorably affect the bacteria, fungi, and viruses that are in our body. So go to the wellness company, check out our array of products. We're really on the leading edge of bringing people to optimal health.
All right, we got 2 minutes for you to explain, as only a professor can. Messenger RNA. My audience is familiar with the term. They haven't got a clue to describe it, on a napkin. What are we talking about?
Well, we have DNA, and the DNA produces natural messenger RNA, which is a signal that goes to the ribosomes, and the ribosomes produce a protein from that code. The messenger RNA is dissolved within a matter of a few minutes or hours. What Pfizer and Moderna did is they made their messenger RNA synthetic for the spike protein. The spike protein is the spine on the surface of the virus, Lance. This is the dangerous part of the virus that causes blood clots and heart damage and kills people. Well, Pfizer and Moderna messenger RNA is indestructible synthetic messenger RNA that codes for this spike protein. That's the reason why it's so dangerous. We clear out the spike protein, and we want to eliminate Pfizer and Moderna from the body. Everybody should get a spike protein blood test and then, see doctors who are forward thinking on this, because, we don't want to see further harm.
And there's a way that you can clean out the messenger RNA from your system. And there again, this stuff could actually be picked up by people that didn't necessarily get a vaccine, right?
Right. That's called shedding. Helene Benoun in France has been the best to show this. Hopefully it's low level at this stage. Fewer than 1% of people are taking these shots, Lance. So we've just got to get them off the market and begin the full recovery.
Well, we appreciate your labors, and at some point we'll have to talk about your experience when you were trying to get preventative steps taken up at the White House. I watched you then with great frustration saying, all this attention going into vaccines, there's preventative things you could do, and they just weren't interested in that because somebody was marketing for the pharmaceuticals, and that's, am I reading that right? Pretty much?
That's exactly right. Early treatment was suppressed in order to essentially railroad the country into mass vaccination.
Well, Dr. Peter McCullough, thank you very much. I know you got a hard exit, so we enjoy being with you. We'll have you back again. Look forward to seeing you at the summit for sure in Florida.
See you soon, Lance. Thanks.
All right. God bless you. Look, you guys don't want to miss this. There's a lot of stuff I can't talk about on the air. You get to talk about him directly. And January 15th, 16th, and 17th, then we're going to have a mastermind on deliverance for spirit, soul, and body. We're going to cover the spiritual and the physical, the natural, the emotional. We're talking about total optimum peak health and performance. thehealthsummit.us. Go there. Make sure you reserve your seat for the January 15th, 18th. See that lineup I've got? Every one of them has an expertise in an area. These are some of the top docs in the country. And we'll see you again on the next episode.
Did you enjoy this latest episode? Please remember to share it with your friends, because the more knowledge you have, the better equipped you are